What is iron deficiency?
Iron deficiency occurs when your body doesn't have enough iron to produce healthy red blood cells. This nutrient is essential for carrying oxygen throughout your body and supporting overall energy levels. Iron deficiency is a common nutritional problem worldwide and can affect people of any age, but is especially common in women, children, and individuals with certain health conditions.
Common causes of iron deficiency.
The main causes of iron deficiency include inadequate dietary intake, blood loss, and absorption problems. Vegetarians or those with poor diets may not get enough iron. Women may lose iron during menstruation or pregnancy. Digestive conditions like celiac disease or surgeries affecting the gut can reduce iron absorption. Chronic bleeding, even from the gums or intestines, also lowers iron stores.
Spotting the symptoms.
The symptoms of iron deficiency can vary, often starting subtly. Common signs include fatigue, weakness, pale skin, and shortness of breath. Some people might experience headaches, dizziness, brittle nails, or a sore tongue. Severe deficiency can cause rapid heartbeat and restless legs. Because these symptoms are shared with other conditions, it's important to talk to a healthcare provider for proper diagnosis.
Iron-rich foods to prevent deficiency.
Eating a varied diet is key to preventing iron deficiency. Good animal-based sources include red meat, poultry, and fish, which contain highly absorbable heme iron. For plant-based options, choose lentils, beans, tofu, spinach, and fortified cereals. Pairing plant sources with vitamin C-rich foods like oranges or bell peppers can boost iron absorption. Regular inclusion of these foods supports healthy iron levels.
Healthy habits for iron wellness.
To maintain healthy iron levels, aim for balanced meals and listen to your body's signals. Avoid drinking tea or coffee with meals as they can hinder iron absorption. Discuss potential supplementation with your healthcare provider, especially if you're at higher risk. Prioritize regular checkups, and if you notice ongoing symptoms like fatigue or pale skin, seek medical advice to address possible iron deficiency promptly.